All right, let's call this meeting to order at 10:06. I'm co-chair of the meeting for 189. We'll introduce ourselves.
Oh, Richard Ortiz, co-chair of Budget and Appropriations.
Anita Martinez, 139.
Maria Prayer, non-committee member.
Dasha Spell,
138, I'm sorry.
Dasha Spell, 132nd, non-member.
Dr. Rodriguez, Director of Health and Social Services.
Jessica Baldwin, Vital Records.
Regina Vermont, Director of Youth Services.
Mark Hart, Youth Program Manager, Lighthouse.
Alfred Vital Records.
Keisha Vital Records.
Anthony Palladino, Mayor.
Constance Vickers, Deputy CAO.
Introduce yourself.
Myrna Reyes, Health Department. Jennifer DeGrassa, Health Department.
Mike Sampieri, Weights and Measures.
Jennifer Rocha, Director of Code Enforcement.
Tammy Papa, local assist for the health department, work ambulance.
Cody Fulton, Public Health Nursing Supervisor. Maria Guida, Special Project Coordinator for the Health Department.
Loretta, thank you. I was District 134, non-committee member.
Fredo Castillo, Committee Member, 136.
George Cruz, 131st District, non-committee member.
Ava Medina, 138th district, non-committee member.
And we also have,
Still,
oh, I'm sorry, go ahead.
Denise Stella Moy, 131, non-committee member.
Maria Nedvadia, 137th, non-committee member.
Renee McBride Lee, 135th Committee member.
Okay, and we also have, we're joined by Council President who's online, Jeanette Herring. Hello, Jeanette.
Good evening, everybody.
Good evening.
Good evening.
Okay, Ken Flato is a little bit under the weather. And usually he gives an overview of what your department is looking for, how much money more. So, let me exhibit this.
Exhibit is the Health Department Division, and made it clear for FY 2027, 0505, 2026-A.
It's been moved and probably second. All those in favor?
Aye.
Any opposed? Ayes have it. All right, yeah, this one.
We'll get that.
As of 2027, they are looking for a full-time nurse. 50% of the salary, which is estimated at $40,000 plus, will be picked up by the health department. Lighthouse budget increase was $315,000. Proposed site for the Raphael Taylor Community Center. As you know, our council partner and I are trying to do some stuff at the Taylor Center, and we thought the Lighthouse might be able to help us. They also proposed needs for summer school youth employment due to new state federal funding, $150,000. Proposed expansion of school Friday evening program, $100,000. They would like to, the staff would like to propose after budget submission, no budget impact, it's no budget impact. Sanitation from housing code, they want to move some folks to environmental health, no budget impact. Code enforcement, relocate coordinator from social service to housing code, no net budget impact. So they have recommended that they move some of their staff around to those departments that need the most help that they oversee. And so we've already exhibited it. We were joined by Councilman Hodges and Councilman Boyd. Councilman Hodges is a member of the committee, Councilman Boyd isn't. We're also joined by the mayor's, not chief of staff, but CAO, who has joined us. So that's pretty much the layout. So what I'll do now is turn it over to,
What you gave us, the handout, please.
oh, okay, that's right, okay.
Thank you, sir. We're gonna exhibit the Department of Health and Social Services for the FY 26 and 27, 0505, 26-B.
Okay.
There you go.
It's been moved and properly second. All those in favor?
Aye.
Any opposed? Ayes have it. Okay.
Good evening, everyone. Again, the Director of Health and Social Services. And in front of you, you have your packet, so I won't bore you with a lot of the details from the slides. You can read at your leisure. There are numbers, so we can follow.
Page 377, if those that want to follow.
You show up?
377.
So our mission, again, is to create a thriving community where every individual, regardless of background or circumstances, can achieve optimal health and well-being. Our mission basically is we're dedicated to enhancing the health and well-being of the Bridgeport community. And so the presentation with your approval will follow for the following departments. We'll cover health administration first, vital records, veteran affairs, Department of Aging, environmental health, weights and measures, the health department clinic, anti-blight, lead poisoning prevention program, housing code and commercial code enforcement, to the lighthouse program / youth services, and then finalizing with social services. So here's our organizational chart. I want to start with, as the co-chair, Councilman Newton said, I want to propose a reorganization to relocate the housing code, blight, and lead division, move them over to the existing social services area. The division is growing, they need the space, and so social services, which is a smaller division, has a lot of space over there. So what I would propose, if you approve, is to move the code enforcement relocation coordinator that is currently housed in social services back to the housing code division from where it was 2 years ago. It does tie into the services with its code enforcement, whether it's fire, lead, or relocation. That position should really fall back under housing code. I'd like to move the fair rent liaison and the commission again under the housing code. It does tie into code enforcement as tenants come and complain within the city of increased rent. Sometimes there are some violations in terms of the apartment and housing code, so it makes more sense to gather that back into and move it into housing code with your permission. I want to move the lead staff that's currently within the health administration over to the social services area. If any of you have visited social services, when you come into the back, it's that room to the right that has some cubicles in there, so the lead division can stay as a team in that area. And then housing code blight will be in the back room where right now some of the social service staff is there. I want to also move the existing cubicles, so there's going to be very little out-of-pocket expense, but the current cubicles that the staff is using with the help of public facilities and IT after an assessment, move those cubicles over to social services and then take the existing cubicles over to the health administration offices. And then sharing common space. Then from the social services staff, I am proposing to, assign a interim director of clinical services and keep relocation, renters rebate, the community case manager, the initiative and community engagement specialist, and the LCSWs into the CIT program in that area as well in the health administration office. Providing an office for the interim director of clinical services in the admin division, and then the data coordinator that's currently housed in social services to the front of the health administration offices to be with the data analyst as their receptionist.
I will also been joined by Councilwoman Ida Nieves. Online. Yeah, she can walk.
No, but you walk that way.
The next slide just kind of gives us a little bit of an operational benefit in this proposed reorg plan. If you approve the plan, it will provide a faster response time for any housing-related cases. It'll also give us a stronger social services focus within social services within the department. It will reduce the duplication efforts across departments because sometimes what's happening, we don't know who's working with what, and so I want to minimize that and keep it in the one area. It'll also improve communication and any follow-up. And again, it will provide a better experience for the residents within the city. And so if we do make this move with your approval, I see the Housing Code Division better positioned to ensure compliance with our local ordinance as well as state ordinances, using the documentation for hearing and appeals, and then as well to ensure effective enforcement timelines. Any questions?
Let her do
We'll
a
pull the first
presentation,
and then if the
Yeah.
questions come out.
and then just write down what section you'd like to speak on. Go ahead.
So, continuing with the proposed reorg plan, if you approve, it's gonna be in phases. Working with public facilities, we have to work with ITS to do an assessment of the data needs and the network needs there. But if you were to approve it, there are some low-hanging fruit that I can implement, which would just be moving the positions by June 1st. But the actual move from between the departments will take a little bit longer, because I'm waiting for public facilities and IT to do. But I have an outline plan for you within the next 30, 60, 90 days, just a quick snapshot of what that would entail.
Thank you.
Okay? And I leave that to your leisure to read. And so, entering now into our health administration. I'm gonna provide for you all the local grants that we have within our division. The first 1, 2, 3, 4, 5, 6, 7, this whole page until DCF YSB, that comes out of the Lighthouse Youth Service Program. Our per capita, 257,000. Our heart and disease, it's 200,000. We're in year 2 of a 4-year grant for that expense. We have our emergency preparedness, public health emergency preparedness grant. That's in year 5 of our grant cycle. We were just awarded the gun violence, which is $1 million. It's a 2-year grant. We are in the first year of that grant. We have our senior center ARPA grant, and that ends this year. We have $12,800 for our elderly Hispanic coordinator that we're currently in now. That's a yearly grant. And then the SWACA recreation for the $24,000, again, that's a yearly grant. We have a greenhouse impact grant, which we're working with OPED. It's a $75,000 grant. It's a yearly grant there, this 1 year. We have an extreme heat and air quality, which that grant is actually having the city propose what are the issues within the city when we have extreme heat to devise a plan. So this will also be shared with the EOC and the city as well for those hot days where we have those asthmatics and the flags tell us how bad the air quality is. We have our workforce development grant. That's a $774,000 grant. That's a 4-year grant. We're currently in year 3 of that grant. That is going to help support the existing staff that we have, training, development, to bring our workforce up to the 21st century per se. We have a tobacco grant, $773,000. That's a 3-year grant. We're in year 1 of that grant. We were awarded the lead HUD grant, $6 million. We are in year 2 of a 4-year grant cycle for that one. CDBG granted us a lead match of $25,000, and that would be for 1 year. And then the CDBG clinic, which was $350,000, that ends now. That was awarded to us to be making alterations and enhancements to the clinic, which unfortunately Jody will talk about, that we've been displaced, but while we were there, we have been able to use the $350,000 for it. I'm going to turn it over to Jessica Baldwin, who's in charge of our vital records.
Good evening. Our vital records mission statement. The main purpose of the division is to receive, certify, file, maintain, protect, and preserve the city's vital records as dictated by law. The office strives to provide excellent customer service to the public in an efficient, professional, courteous manner, with the goal of being recognized by others both in and outside the working environment as an outstanding department staffed by highly competent municipal employees.
That's just our goals, right? So here's our main.
Okay. Our expenses, the division doesn't anticipate exceeding the division's original appropriation. The Vital Records Division has collected 75% of its budgeted revenue appropriation as of April 21st. Accomplishments, I'm very happy to announce that we had a $3 fee on the Vital check. I don't know if you remember, we talked about this last budget, and we were going to try and bring the fee up with the appropriations with the Vital check company. They did an audit with us and saw that we were doing the volume that I had said to them that we were doing, and they granted us the $10 increasement from $3. So we are now making as a city $10 per transaction versus $3. which has brought our revenue from normally $5,000 to $20,000 today. So that's an increase on our division that we are very proud of.
I will cover Veteran Affairs. Unfortunately, Cindy was sick today. So our Veteran Affairs, again, is to ensure the provision and coordination of human services for our armed force veterans. What Cindy has been doing is a phenomenal job. She has increased our numbers to about 87 registered veterans, but she's also collected in terms of grants. She received an American Legion Post. They awarded her $2,000, which went to creating new flooring for the Thorn Street location, which used to be the old senior center. The American Legion Post, again, 177, awarded them $1,000, and that's going to help pay for the wreaths for Memorial Day for the veterans. And then just recently, 2 weeks ago, Optimum Cable awarded them $2,500 to support their food bank. They also collected and did a food drive, and so we were happy about that for her this year. She has now 87 registered veterans within the program. They have partnered with Goodwill and the U.S. Department of Veteran Affairs, and she has been able to, in this year, house permanently 12 veterans. Through their workshop, she was able to assist 4 veterans in achieving home ownership, and by way of that is, she has also helped them receive the benefits that they didn't realize that they had, and some of them have received lump sums of $70,000, $80,000, almost $100,000. And so with her guidance and the VA, they've been able to buy their own home, so that's a big accomplishment for her. She co-chaired the 2025 Veteran Stand Down. There were over 200 veterans there. She has her own food pantry as well as a clothing donation area that she gives to the veterans when needed. She has also launched a new Bridgeport chapter of the Disabled American Veterans, and that's growing rapidly. She has participated in the Miss Juliet Taylor, who was honored by the City of Bridgeport Mayor and City Council. And so she has also represented up at the State Legislative Building, honoring the women veterans statewide. So she alone has accomplished quite a bit. Her veterans love her. She's actually making a lot of improvements within the division to make it a more warm and friendly environment. Marie Heller, I don't know if she's here, she may not be here, and she wasn't feeling good also, so I'll cover for Marie Heller. Good news, between all 3 senior centers, we have 825 active members that come to the senior center on a daily basis. And what they have accomplished is they have collaborated with the Golden Hill Methodist Church literally next door. We just signed the contract. They are now allowing the seniors to park in their parking lot. So they no longer have to park on the street and be afraid of receiving tickets for parking there, right? And so this will also help them in terms of mobility. They won't have to be parking further down the street to come over. She has also done, in the past, limited to 3 centers, but they've combined, they're working together, they're actually doing events together, and which is really good. Not that they didn't do it, but it's been more robust this year as well. They've also fostered a sense of community within the seniors. They've allowed to share resources and offer more programs within all 3 sections, and it has also increased their membership by 25% from last year. And so she wants to just thank everyone again for promoting their initiatives and their services and their dedication to the seniors within our city. And keep promoting our senior center so they can become members. I will cover our environmental health division. So our main goal again is to ensure licensing and inspections according to the general statutes and our ordinance. Our law, short-term grants, we're still trying to get all of our establishment applications streamlined. I am working with ITS to get us our software that's dedicated to environmental health, so that should help streamline that process. And, oh, okay, that's great news. Within just our food establishment, revenue that we've collected up to date has been $236,900. That's just the licensing fee. The cosmetology, we've gotten $8,100. Other services, which includes late fees, our staff has really been hammering. We've collected $29,545, of which I think is $14,000-15,000, Maria, of late fees that we've collected. So we have brought, so far, $271,545, and we're not done with the fiscal year. And we just finished our food truck inspections. We've licensed them. There are still some stragglers that are around, but we are sending them their notice of non-compliance, and they will start being fined $100 a day for not having their license. Mr. Sampieri,
Yes,
you're up for weights and measures,
okay, what was that?
or you want me to?
You can do it.
Okay.
I'll give you the floor.
So,
You're doing a great job.
So nice.
so as Mike and Raymond Laracuente are in charge of our gas stations, pawn shops, bodegas, anything that has a scale. And so what we want to ensure is the accuracy and monitoring that that scale does not overcharge or undercharge any of the clients that come into the businesses. And so they have been, revenue has gone up. From 2024, we had put in 93,450. Last year was 93,190. And so far, which the year hasn't ended, we are at 87,510. So we probably hit that mark, if not go a little bit more at the end of the budget year. And this is the summertime, so now Raymond and Mike are doing the gas stations, which take a long period of time. And so once that hits in the fall, winter, they'll go back to the supermarkets and the bodegas, because with the winter months, they cannot conduct the gas station pumping because you have to remove the gas and then it'll interfere in terms of the weather. So this summer, they're gonna be busy with the gas stations. Up next is Jody with the,
You're doing a good job, so.
no, we don't want to talk about it.
Sorry.
And
Good evening, everybody. Fiscal year started out great. In July 2025, we had a full-time APRN after not having one for many years. So our object and our goal was to get the clinic up and running again with everything open, and we did succeed. We had the STI program open 2 days to 3 days a week. We had latent TB program when we started that. We had, I will show numbers during my speech. We did have that up and open, along with doing all of the TB, which we have a contract with the state. October 5th, I got a call on a Sunday that water was coming out from under my door and the fire department was at my clinic. I went down, I walked in, I called Dr. Rodriguez and I said, we have a problem. And we have been out of the clinic ever since then. Prior to that, there's been HVAC issues where I had to send my staff home or send them over to Broad Street because there was no heat in the building. There was no heat. So, on a good note though, we are working out of the health department on Broad Street. We are unable to see STI patients. We are referring those to different agencies such as Doc's Urgent Care or Planned Parenthood. Because of where we are set, we really can't do cultures and the samples where we are. But we are continuing with everything else. I did put a lot of information in this PowerPoint just because people think we sit in the clinic. What are they doing? So I did try to give a broad overview of what we do here in the clinic. We do have the TB program, which I went into detail of what we do for the TB program. The STI and HIV, we did want to expand those in the future. We wanted to bring expedited partner therapy. We were working with the health, with the medical director, Dr. Holder, to bring in PrEP and HIV expansion, but unfortunately, due to the flooding that has been all been put on hold.
I just want to say that we've been enjoying that Councilwoman Nicole, who's a committee from the 130th. Okay, continue.
Thank you. We did do our influenza vaccine clinics, we did do adult clinics, and we also incorporated pediatrics this year. We did collaborate with the Bridgeport Board of Education, the nursing supervisor. We did clinics in the libraries, and we also did them for the staff. We scheduled them on one session day so the kids would not have to miss any school. So that was the first time we did do the pediatrics in years. We also do disease surveillance and outbreak response. The measles was a big one. We were working around the clock. We had 48 cases that were contacts to the measles that we were following for at least 3 weeks. We had to contact them every other day to see if they were symptomatic. And if they were, then we had to go down line who's next that they have contact with. So we did work with the DPH for that for at least a month. We do monitor the foodborne illnesses, disease surveillance, and all data tracking. Our flu clinics last year, we gave 173 flu vaccines. This year, we gave 435, which is an increase of 145%. We did senior centers, homeless shelters, methadone clinics, like I said, the pediatrics. We did all of the senior centers here in Bridgeport that were city run. As you can see, our numbers did slow down November, December, but our peak months are September and October. And we did well, so I was happy with that. As for TB, as you can see, our TB numbers this year so far are at 24, which should actually now be 25. We did get another TB case today. Unfortunately, the numbers in TB, we have doubled since last year, and I do not see those numbers dropping anytime soon. Along with more TB cases, we do get the DOT, which are 7 days a week because of multi-drug resistant. So that does require my nurse to work 7 days a week to monitor that. With more TB cases, we are getting more contact investigations, which we are responsible to make sure they have all their testing done. And if they are positive, we do follow up and we do give them treatment. As Doc was saying, because we don't have a clinic, we are going to people's homes, just like the good old-fashioned visiting nurses. We're going to the homes to do an assessment with them, to bring them their medication. A lot of them are afraid to come into our building because it is a government building. But the ones that will come in, we are working with them, and we do have a supply closet that we have a table in, and we are doing assessments in there.
You also enjoy Councilwoman Michelle. Slide down.
Thank you. This is our projected reimbursement fees from the Connecticut DPH-TB program. We have, the next slide will show we have gotten revenue, but they are very behind. So this is for the fiscal year starting in 2025, and this is what we have billed the TB program for, which is approximately $49,000. This is our revenue in units as of today. For STI, we only did it for a couple of months, and we already had revenue of $1,780. We have increased our prices from $10 to $20 per patient. That includes screening, treatment, and any follow-up visits. And our numbers have gone up, which I will show you in the STI portion. Tuberculosis from the TB program, we have received $36,269.66. Influenza, we have about $1,600 to $16,200, which is $54,249.45 revenue as of today, which we still have all those pending from the Connecticut DPH. This is showing our STI clinic. When we started in July, it was brand new, that we haven't had it open for years, and we, at that point, had 24 patients. August went up to 29, and September was up to 44. That's with no advertisement, word of mouth, was out, and they were excited to come back. On October, we only had 7. Again, we had to close on the 5th. This is just showing, this is working, I worked with epidemiology, and it looked like our numbers in Bridgeport were going down for chlamydia and gonorrhea. But she was saying that that is not a true reflection. It's a lot of people are not getting tested because they cannot afford it. We have calls every day looking for when our clinic is opening. This is just to show you what the costs are for our clinic compared to everywhere around, like Quest, LabCorp, which is Walgreens, AFC, Planned Parenthood, Doc's Urgent Care. As you can see, what we give for $20, these people, a lot of them, they just cannot afford to go and get treatment or screening or testing. We do have the grant. The grant did buy all brand new equipment for the clinic. A couple pieces were damaged due to the water, so we're waiting to hear from see if we can repurchase those. But otherwise, we had everything brand new in the clinic. It looked beautiful.
Anti-blight and Karocha.
Good evening. Good evening, I'm Jennifer Roach, I'm the Director of Code Enforcement. I currently oversee anti-blight housing codes and lead. With the support of the CA's office, I'm happy to report that we are 1 month into our new ordinance, which has increased the violations to higher fines, shortened compliance timelines. We have reduced the warning period time to 10 days from 14. We are continuing to reinforce the third offense fine, which would be $1,000 per day. And we have implemented a new appeal process. These are numbers of our blighted properties for last year and this year. So far, we have collected $41,000. We have blighted 1,200 properties.
How much was that revenue? The revenue for 24 or 24? Oh, you're almost like year to date.
Maria.
I just didn't hear what she said.
Okay.
What was the number?
Can you show us your
141,000.
please?
For this year, thank you.
Okay. Continue.
Housing code and commercial codes. So far, we've had 759 complaints, 211 cases are in process. We've received over the winter 186 no heat complaints with 35 no hot water complaints. We have increased our revenue for our CAOs, rooming house, and hotel fees. As you can see from 2024 to 2025, there has been a dramatic increase. I know that was something that was promised by Maria Guida from last year, so we have, for this year, we're at 24,000 for CAOs and 16,000 for rooming house. I also oversee the lead department. Our goal is to prevent and protect Bridgeport children under the age of 6. We want to comply with federal and state and local mandates. So far, we have inspected, provided education to 319 children/families. And along with our LET grant that was funded in February 2025, we have remediated 47 units in the city of Bridgeport.
We'll have Regina discuss the Lighthouse Program User Services.
Again, my name is Regina Beaumont, and with me this evening I have Mark Harp, who is the Youth Programs Manager. So the Department of Youth Services plays a critical role in supporting Bridgeport's young people through our Youth Service Bureau and Lighthouse After School Program and more. We remain committed to our core mission and vision of providing safe, structured, and enriching environments that support academic success, social, emotional development, and overall youth well-being. Over the past year, we've continued impactful programming. While we are proud of this progress, as we move forward, our priority is to sustain high-quality programming while expanding access to even more youth so that they can benefit. I want to thank City Council for your continued support and investment in the youth of Bridgeport. Together, we are creating opportunities that positively shape the future of our community. Thank you, and we will now move forward with the rest of the presentation. The slide back, please.
The goals, this one?
Which is the indicators.
Oh, yeah, it's the new system, took the picture up, but they have it under PowerPoint.
Okay, thank you. So just, I want to take a moment to just spotlight briefly the key services indicators for the Department of Youth Services, highlighting our growth, reach, and impact across several core areas of service. Our service indicators reflect not only the number of individuals we serve, but the depth of our engagement with youth and families across the city of Bridgeport. So the highlighted areas include after-school participation, summer programming, volunteer engagement, summer youth employment, parent involvement, and our outreach efforts. Next slide.
Just while you're doing it, we have another councilman, Councilman Galen, who's online. Also. Okay.
So on this slide, you will see the sites that actually, the Lighthouse after-school program sites that do not have grant funding for 2026-27 at this juncture. You'll see it's Garner Walterville, but once an RFP comes out, we anticipate applying. Also Beardsley School, Bryant, we anticipate applying. Park City Magnet, Dunbar, I will move forward with the note on the bottom. Edison and Hall is transported to JFK due to lack of grant funding. And we also will plan to, with your permission, open Bassett, Harding, and Central again for Friday Night Live. So we are requesting $65,000 additional dollars to open an after-school program at Lafola Taylor, Dunbar School, and an additional $100,000 is requested to fund Friday Night Live at the three major high schools, which is Bassett, Harding, and Central. Okay, moving on, we have our grant and parent fee updates. You'll see them here. In terms of our grants, just please note when you see the, for example, Bataya, Creole, and Columbus, year 3 of the of 5 years, that $250,000 is actually divided amongst them. It's not $250,000 each. So just want to make that note there. In terms of parent fees, it was moved down to bullet 4. You will see as of April 8th what our parent collection fees have been. In terms of YSB, we did receive that grant, and the amount is $1,331,877. And you'll also know our YSB enhancement fees. Not fees, grant. Again, our current Lighthouse programs areas are, we have our before school, after school, our BYC club, which is Bridgeport, stands for Bridgeport Youth Club, which is for our middle schoolers, and it is youth led. And then we also have our summer program, which runs from 8:30 to 5:30 p.m. for 5 weeks during the summer. In terms of our additional programs, we have our summer youth employment, in which we are also requesting $150,000 additional dollars to hire 85 additional youth for the summer. So that will be an estimated 225 students total for this summer, if approved. We've actually been had the application open for about a week, and we already have over 500 applications. In addition, we will know our year-round employment. We did receive grant funding, so we were able to hire additional youth for this school year. For the fall, we hired 11 students and high school students, and during the springtime from January to currently, we hired 13 students. In addition, you see our YSD programs and referrals, as well as our youth ambassadors. Many of you have had the pleasure to see them during your council session. So please, thank you for embracing them. Additionally, we have been continuing to engage the community. You see our partners here in terms of support of our programs. We have Brothers Table, which is facilitated by Buddy Jordan Foundation, Live Girl, we have Leaning Girl, the Sheehan Center, Junior Achievement is a partner. So we've really been utilizing our community resources to adequately and effectively support our Lighthouse programming.
And to go into the final segment, Ms. Douglas couldn't be in today, she's out. Oh, you have one more thing?
Yes, sorry, one more thing, okay. Let me put that right now. So, while we're here, I'd like to invite you all to our Lighthouse Program Gospel Choir concert that will be taking place in the Chambers on May the 29th. So we'll pass that around. We look forward to seeing you all.
Okay.
So social services, right now the mission is focusing on enhancing the well-being of vulnerable individuals in community, and the services that we're currently providing is relocation, and that's due to fire, housing code enforcement, and lead. We have fair rent as well as a fair rent commission, and we have renter's rebate, which is actively being done now. We also are referral based, so people can refer in and we refer individuals out, and we're also providing the ADA placards. So if individuals who want the parking sign on their street, they go in through the portal, fill out the application, and Miss Amy will fill out the paperwork after PD gets a hold of it. And so some highlights that the department has accomplished this year: they've done 8 community education sessions and they participated in 25 events. Ms. Nadine was able to provide 3 trainings on mental health first aid, and so she certified 30 participants in mental health first aid. We've held Narcan training during those 2 sessions. We've prepared 25 individuals to be able to assist anyone that may be suspicious of overdosing with the Narcan training. We have a phenomenal police collaboration with the CIT team. Linda Lubin and Johanna are doing a phenomenal job. They are 911 response. So if a 911 call comes into the police department, if there's some type of behavioral health, mental health issue, and they need assistance, then Linda and Johanna, Linda does the day shift, Johanna does the second shift, and they will respond with the police department. And as if you're aware, if the individual needs to be committed to the hospital, the police department does that. If not, then Linda or Joanna will do an assessment and do the follow-up and community referrals that are needed for that individual. So far, we have served 87 individuals in fair rent complaints. They presented 8 cases to the Fair Rent Commission. We have last year served 3,275 renters rebate, and they've done a total of 1,177 social work referrals, and of those we've done 190 housing code referrals as well. They've done some training with ASSIST, which is a suicide intervention program, and again, mental health first aid and the Narcan training. We do not collect revenue in social services, but we do get a grant for the CDBG utility protection, which is actively happening now, and we're almost close to hitting the 100 numbers of applicants that are come in. And we do receive the SWACA grant for the elderly Hispanic coordinator, which is 10 hours, and we have spoken to SWACA, and we had one of the monitoring sessions April, and they are aware of all the work that Iris is doing, and finally came to realize that 10 hours is not enough. So hopefully for the next funding season, they're gonna give us at least, I'm gonna aim for 20 to 25 hours. And they are aware, Gretchen is aware of how much work is being done during the day, and a lot of it is referrals and follow-ups after hours, which Iris does. And this is just a quick picture of some of the highlights that we've done. Our nurses participated in the Norwalk Community Fair. The gentleman made his debut in the center picture on Facebook. One thing I do want to highlight, we and the health department with environmental health are a part of the police task force. to address the illegal establishments that are within the city. And so we've been working with Lieutenant Duarte, Harper, and Piscone to hit the smoke shops, the illegal liquor stores that are there. And this weekend, this was a a renter for a single-family home who was using their garage as a food establishment and then decked out the deck to make it more. We worked with the police department on Saturday and we shut them down, and of course they posted a picture on Facebook and Guillermo was there. But that's just one of the things that we're seeing in terms of the after-hour events and overtime, and it's really working. And so people are now telling each other what's happening, and we're getting a lot of people coming into the health department to start applying for their licenses and permits, so that's really what we want. There's a picture of Anthony and Myrna. There was an event in the community. Eddie was doing a home inspection. You can see the housing code violations there on the apartment. And again, I don't know why they threw my picture in there, but must have been the farmer's market that's going to be occurring this summer. That starts July 15th till October. And so we have the hypertension grant that's also doing blood pressure screening with our contractors. And that's the end of my presentation to you, and I thank you for affording the opportunity, and we'll answer any questions that you may have.
All right, just before we open it up for questions, those kind of things, they're asking for moving staff around.
Would you kindly speak up louder?
Before we start asking questions, I hope that you all will keep it as close to what they're asking for, why they're asking for more staff. I know we'll have a tendency to talk about things in our district, but that's not what this meeting's for. So I'm sure I will allow everybody to ask their 2 questions and then rotate around. So council people, I would hope you all will be respectful to our guests. And if I get the feeling that you're being disrespectful to one of these individuals up here, then I will step in and shut it down. You just said something?
You sure committee members go first?
Committee members go first, then
The non-committee members?
non-committee members will go after that. We will allow you to ask your 2 questions and then fall in line for a follow-up if you have it. Our first person is Representative Afraid.
I just have one question. For the department that makes a lot of, that brings in money, how do you attracting a full-time nurse at 40 grand?
No, it's part-time. The other half, we're gonna use opioid funding money, and so that will cover the full-time salary. So the 40, it's almost a 50 split. Half of it's gonna come out of general funds, the other half is gonna come out of the opioid grant funding for the full-time nurse.
I'm just saying that, I think that's the hope now.
It's the
That's,
salary.
you know, you're attracting people with license, and you want them to go into our city to find 40, whatever it is. I think it's just a low number, and you're bringing in money. So you should be adding stuff in there to equip your staff to do the city business, because you're bringing in money.
Okay, 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 Reverend Lee.
I heard a lot about revenue and and I saw a lot of dollar signs up there. What happened to that revenue that you bring in?
It goes into the general fund. We don't get any of it.
Is that but I guess I have to ask the chair this, do we see that in the
What they're bringing in revenue, yes.
yeah, in the general fund?
Yes.
You see? Okay, I'm gonna have to look for that, cause to me, that's a lot of money they bringing in, it seems to know, so, okay. My second question is when we talk about, I think this would go to the after-school program. You said that we want 85 more hired, and how many of you do we hire in the summertime now?
It's about 150.
Less than 150.
Yeah, less than 150, yeah.
Less than 150. Last year I had over 800 applications. We only hired about 135, 136 is what our base came up to.
So if
We're trying to up some more.
If approved, we'd be able to hire at least 85 more students.
Do you think that there's a way that the after-school program, or the after-school, no, not necessarily you all, but is there a way that we can kind of, not with us, that we can kind of increase that number? That's a pretty low amount of
I've been asking for, Reverend Lee, I've been asking for a long time. Been asking for an increase.
Well, who you been asking?
I ask all the time. You don't hear me asking? Mr. Garnett, can I have some more money?
Okay, relax. We do it through the chair, please.
Yeah, well, I did that. I did. That's what I'm talking about.
Okay, Brad.
You're more than welcome to add to it.
Okay. Well, then, I don't know, because I'm not going to say that we're going to give more money or whatever the case might be. But a lot of talk is about our young folks this and our young folks need this and this and that for our young people. It's important that some of these kids have jobs in the summertime. Because they're not going to do nothing but lay up in the bed and play those things. That's why they can't read and write. Because that thing speaks to them and they don't have to say a word, they just go. And I think that it has to be some grant somewhere or something that we can increase them, and we should just depend on here to get that money, because most of the time we don't have it to give in the first place. So I think that's what, to me, summer school jobs is very important. And to piggyback off what I said, the people that you hire, do you hire a whole bunch of new people, or do we? We don't. Whoever best fits the criteria. Yeah, that's good. Because I know it's bad. The same one got hired every year. Not exactly. Well, they look alike. I hate to say it. I go through all of them. So I don't believe in that either, because I don't look like nobody around the state. But I'm saying, what I'm saying is that there have been, and I've been on this council for going into 14 years, and been on the budget just about that long. So, and been in the school system for 30-some years, so I know the scope. So the thing about it is that we want to make sure that, and I believe that you all want to do it, make sure that people have never gotten hired, is because the ones that have been hired before, naturally they're more qualified than anybody else. Okay, I'll just wait till my other.
Thank you, I do appreciate it very much.
You're very welcome.
Thank you. Fred Hodge.
Yes, thank you through the chair. Just to follow up what Beverly is saying, and you were saying that you're looking for some money. What was the numbers you would like to get, Regina?
Are we referring to the summer youth
Yep.
employment, or it's an additional $150,000?
Additional $150,000, and was there another number also?
Yes, separately, it was $65,000 for Taylor Center and Dunbar School.
65,000, and then you said one what?
$100,000 for Central Vascular Heart.
And Dr. Rodriguez, you said all the money goes in the general fund?
Yes, sir. Well, with the exception
But
of
now
their
still my
grants,
first question.
their grants, sorry, so their
Right.
grants is, most of these grants stay in that program, but if the grants that are not funded, then whatever we seek, that's what we're asking, but whatever revenue we bring in does go back to the general funds, we don't have.
And I'm kind of in agreement with Pastor Lee right there. Our youth is very important in our city, and just to have 150 hirings and the 85 she's asking, just bring it up to 250, I think that's a disgrace to our youth in this city, that we only hire 250 youth for the whole summer. And not to help that youth, that Lifehouse program, which has been very instrumental for our youth for the years in this city, is a shame. So I think that we need to really think and consider giving them that little $150,000 or $200,000 that they need to move forward. Thank you very much.
All right. You all set? You all set, Fred?
Yes, sir, thank you.
Okay. Maria Carrera.
Okay, my first question, I don't know if you can get back to page 3 or slide 5, if that's possible. Thank you for the page numbers, and you even have slide numbers, you get an A+.
See which one is five.
Slide 5.
The reorg?
Yeah, so I want to understand if I want to know if I'm understanding this correctly. If I'm reading this, I feel like what you're really mostly asking here is to move the physical location
Yes.
of people and desks and where, and or you're moving positions from one budget department to another.
Both.
Okay, but 1, 2, 3, 4, 7 of these look like physical location. And I just want to say, you are the health director of the largest city in the state. And if we have to approve where people sit and what cubicles they're in, that would be ridiculous. I mean, if you keep, that's your job to decide. We shouldn't be micromanaging where people's offices are or where they sit. That's just my viewpoint, okay? Now, for the others that have to transfer from a department to department, what is the net increase of any positions you're asking for?
There isn't, it's just moving them out of one budget line, out of social services, over to housing code to make it a better alignment for that position. There should be no increase in funding.
And I just want, does somebody direct you to ask us to approve or
No,
people sit in your office?
No,
Okay, no.
I'm just
Referring to, I'll wait for my next round.
That's crazy.
I'm gonna pass on. Let me call it next.
Okay.
Okay, I have quite a bit of questions, so you gotta list me down like 10 more
I
times,
already got
please.
you 10 times.
Alright. So, Doc, in the health department, with the reorganizing, what is the mission and the vision for the reorganizing of the department? Also, I would like to know, where are we with the deputy staff that is needed? Has the position been filled for the Fair Rent Commission? With the biggest revenue department in the city, we are failing with licenses, compliances, plans, dialogues. As I review the budget, whether it goes into general funds or not, this is a critical department that just reorganizing and setting it up in a different structure still does not fulfill the needs and the gaps that we are currently experiencing in this department. As I look at this budget, to me, I feel that your staff overrides the revenue that is coming in.
Let her answer, go ahead.
So,
Let's go with reorganizing. What is the mission and the vision? Because I
So-
gave you a lot.
yeah, you did. So, I wanna look at, the reality is, social services needs a whole revamp, right? And so what can we realistically provide to the community? And what are we currently doing that needs to be improved? So putting in a interim new director of clinical services so we can do a full assessment and determine what is it that we need to do, right? That's the first one. And your other one for environmental health?
So I wasn't
Okay.
simply referring to social service. I was talking in general, your entire health, under your leadership, your entire, everything that you listed on your organizational chart.
So my plan this year is to do a strategic plan. I wanna hire a consultant now that our workforce development grant got approved, and bring in a strategic planning person so that we can look at each division and improve. Yes, you're right, the licensing fees, we are going after that. I did propose to request a new inspector, but that was not approved by OPM. I do have one vacancy that I need to finish out before I can put that to post to fill. You asked about the deputy, right?
Deputy,
So the deputy director,
you gave your dialogue, Fair Rent Commission.
so the deputy director of health position has just been posted. It will close May 20th. We are going to get some applications in. The Fair Rent Commission, we did the first round, and we are doing, either next week or the week after, we're doing round 2 interviews for the Fair Rent coordinator. The other vacancy that we have is the renter's rebate. We posted that internally with no candidates, so now it is going external, so we're waiting to see if anyone's applying for that position.
Gotta wait for my next one.
Okay.
Sorry.
All right. Thank you. Yours Cruz.
Thank you, Mr. Chairman.
He has the list.
Thank you, Dr. Rodriguez, great presentation, you and your team here, great presentation, but me, I'm mostly focused on the fair rent. And I'm glad that my council colleague, Martinez, brought that up about the fair rent, because I'm extremely disappointed, not you. I shared it with you before, and others, and I'm extremely disappointed. After all the hard work that we put into formulating, reactivating this fair rent, it seems like it's dead. And the other thing I'm extremely disappointed is that without mentioning the lady's name, multiple times I said, I want some updates. As a council member, also a person who was involved in reactivating this along with other council colleagues and the attorneys and the CAO and the mayor's administration, we came and we got this fair rent. And me, it's like when I go and ask for information, it's like, they ignore me. And I don't appreciate that. I really don't. I would like to see the fair rent completely separated from the health department. A whole new concept. It should not be under the control of the health department. It should be a separate department. Professionals. Because everyone that has been hired has been a disaster. It's been a disaster. I mean that respectfully. We got to tell the truth. After all these years, 3 years, I believe, it's been in activation, only 87 cases. Sir? Cases presented to fair rent, 8. It's a disaster. And I am asking my council colleagues during the budget to let's explore this a little more constructively, and let's find other ways to separate the fair rent from the health department, because it's just been a disaster. They keep hiring people from within, and they fail. They fail terribly. And that's the fact. I mean that respectfully. And this ain't no joke, because when people call about their rent being increased, they need some help. And we can't have a fair rent department that is out of order. And I'm not being informed. I deserve to receive whatever information is going on, any updates. Why is it so hard that a council member asks for updates and I don't get it? So I'm asking you, Dr. Rodriguez, to consider that, because I am going to be pushing for this fair rent department to be completely separated from the health
Can I
department.
answer your question?
Yes, ma'am.
So this year alone, we have the 87 applications. I would have to get you the numbers from last year. One of the main reasons that only 8 went to the commission is if they can be remediated between the landlord and the tenant, it doesn't have to go to the commission. So those 8 cases, there was just no dealing with the landlord and the tenant, and then that is why it went to the fair commission. But I do hear you.
And just closing, Mr. Chair, the other problem that fair rent been having is the commissioners who accepted to be commissioners, they don't show up for quorum. It's been a problem, so that's something that we also need to discuss. But anyway, my thing is that, again, I asked my council members, so let's talk about that deeply, because it's affecting a lot of families out there. And fair rent commission is something that's not to be treated right now. Thank you, Mr. Chair.
Thank you.
You got the CAO right here, so he knows.
Michelle Line.
Oh, hi. I just have a quick question. I mean, thank you for helping me out today. I really appreciate it. And that was in reference to licensing. That's what we're. So in the license department, when they go out to inspect the trucks, we talked about that. How are we, when do they go out to look at that and how are we doing with the finances coming in with that can provide is adequate staff for the licensing?
So
I heard that being mentioned.
So because their license expires April 30th, March 30th, excuse me, we started doing the inspections. They come to us on Bank Street, the food trucks. And so we were doing every Tuesday and Thursday, all day. They would come without an appointment, and the inspectors will inspect them, renew their license, and issue them their new ticket, their new permit that goes on the truck for the year 2026, right? So they've already done their inspections, and we've collected the revenue for that. There are still some food trucks that didn't come in, and they're receiving letters to say, hey, you missed, you're in non-compliance, you need to renew your license. If not, then the inspector goes out to the owner of record and we'll meet with that person and make sure that they get their license up to the food truck.
So do you know about all the food trucks?
The ones that we have registered and licensed, yes, we do.
From the past?
Yes.
But new ones coming in, how do you handle those?
So the new ones that come in make an appointment, and they are assigned the inspector for that district. They do a plan review, they inspect the truck, they get licensed just the same way, and then they're put on the rotation for next year's licensing.
And it would be up to us to catch the ones who...
If you suspect and they don't have a ticket agreeing with us as
You have enough
2026.
staff to do that, right?
No, I don't.
Okay. That's
Okay.
the question. All right,
All
thank you.
right, thank you. Maria Baez.
Okay, so I saw on the chart lots of grants, lots of money, right, coming in. So my question is, who is going to be, or who is responsible in making sure that each and one of those grants are being met, the criteria? And that basically, that we don't lose money like we did with the elderly Hispanic coordinator, that somebody wasn't watching what was being done, and therefore we lost a lot of money. And that's why it was reduced to the 10 hours. And which right now I understand that the person who is doing is working on that grant. She might be doing a good job, but again, if you look at the manual and what that grant says that must be met is not being done. Because I do have to say that at the Eastside Senior Center, the Hispanic elderly coordinator, I saw her once. I had to send 2 referrals, maybe 3, so that she can see someone. That's not what that grant specifies to do. That grant, and correct me if I'm wrong, is to come to a site, visit, talk to the seniors or whomever, and then come back. I know that the 10 hours are not enough, but if somebody had been watching that door, we will not be right now in this predicament of the 10 hours that this person is doing. So again, this is a lot of money. So I'm hoping that we do not lose money on any of these grants, and who's responsible to make sure that it is being done.
Okay, so to answer your question, the department supervisor has the ultimate oversight of each of the grants that come in. So does myself, and so does Central Grants. I've already met with SWACA, they did their monitoring. They actually gave us some good feedback on how we can bill for the services, so we're actually bringing in revenue for that. And you're right, I agree, the 10 hours is not enough. What happened before put us in this predicament now, but I am overseeing the elderly Hispanic grant now, and I will be meeting, I met with Iris. She does talk to a lot of the Hispanics after hours, they call her, I've been on the weekends sometimes, and so we've already had this meeting with SWACA, and they saw all the work that needs to be done for the city, and they also agree that 10 hours is not enough. But unfortunately, I have to wait for the next grant cycle to put in for more hours. But to your point, between monitoring what she's doing and the units that go in for the reimbursement that comes back, we've hit our target for this first quarter so far.
But again, the elderly Hispanic, to me, and again, I like, it's not doing its job. The elderly Hispanic has, it calls for, even if it was 10 hours, why can't your department hire somebody specifically that will work for those 10 hours? Because even though the woman that is working is awesome, she is awesome. But to me, 10 hours, and you have a 40-hour job somewhere else, how can you service our viejitos that are waiting? We have a woman, and she's still, there's many, who is homeless. She's sleeping in the train station.
If I can answer that, the biggest problem is the 10 hours. No one's applying for the 10 hours.
Yeah.
Iris did. And you're right, she does have a full-time job. She cannot stop for 40 hours to take a 10-hour position with no benefits. That's unfortunate where we are right now. But I'm happy to meet with you if I can get the name of the senior that's living at the train station so that we can send Iris or one of our own teams to go see her.
It's all right. All set?
Yes.
Okay, good. Denise Taylor Moore.
Okay, I just want to say two things. Yes, as far as our youth are concerned.
My vote's my vote, Rich. Okay, my vote's my vote. Why are you bringing that up? Why are you bringing it up, Rich? Why are you bringing that up? You're
Out of order.
Stop it.
Out of order. In the order.
You telling me?
Out of order, please.
What are you talking about? No, I'm not out of order. You are. You brought it up.
Afraid of. That's it. That's it.
You're wrong.
That's it.
Bring me outside. I don't care what you a chair.
Afraid of. That's it.
I don't care. I don't care, Rich. You respect me, I respect you. Okay? No, I didn't disrespect. Oh, I asked you that Pamela had a question to what she was saying.
My partner,
You said no. Okay?
My partner, straight up my
You
partner.
can't follow the rules, that's your
You can't
problem.
follow the rules.
Let the council people talk first.
You said no.
I said the council people talk first, and that's how it goes in order. If you can't follow the order, just let me
Rich,
know.
it's okay. I'm
Okay then.
okay.
All right
All right? You're new to this, all right?
Okay, yep.
All
All
right.
right? You're new. And you ain't there because I helped you.
No,
All right?
no.
All right. Oh, no, yes, you did.
Get
Get
out.
out of here, man. Come on, man.
Whatever, you're a bum right off.
Fredo.
Disgusting.
Maybe we need to take a
What are you
time out.
talking to, man?
Can I make a motion to recess for 5 minutes? I have a day where I keep it down. Can I make a motion to recess for 5 minutes? I can't make a motion to
Not the one.
recess for 5 minutes. Can we take a 5-minute recess?
Not the one, bitch.
I can't make a motion, I'm not
Listen, everybody, don't have me call the police and have y'all escorted out here now.
It doesn't matter to me.
Because I want you to calm
I've been
down.
there, all right?
Y'all calm down.
Through the chair, please. I make a motion that we take a 5-minute break.
I'll second it. You want to take a 5-minute break so everybody calm down.
It is true, I can't sleep through the night, I have to use the bathroom.
Y'all calm down. Yeah, answer Maria's question and we'll move on.
I don't see Councilwoman Baje, but.
All right, wait till she comes back in and then you can answer, all right?
Okay, I just saw
Ernie,
Yes,
I think Rich had called for me.
Yes.
yes, go right ahead.
Okay, but I just wanted to say, I'm in agreement with what Reverend Lee and Hyde said in regards to our youth. Us needing more jobs and hiring more youth during the summer. But I have to say this here, the Lighthouse program in Connecticut works. I have worked with them for many years, and working with them, they showed me exactly how things work out there in the real world in regards to our youth. The type of money that they pay them, how it's up 1 minute and then it's down now. The hours that they work, they give them exactly 20 hours a week. to work. And then the most important thing that people tend to forget is that you gotta have the jobs for them. You don't have a lot of employees that be hiring them. Is Mark in here?
No, he's upstairs. He'll be back
Regina,
downstairs.
am I correct about that?
Yes.
You don't have a lot of employees. The youth go from here to no job if it's nobody there to hire them. And they don't pay them. We don't, Lighthouse and Connecticut Works pay them. So I want to say is that I do believe they need more money to hire more youth, but I also believe that we as a city, we need to be making sure that jobs are marketing themselves the correct way so that these youths can get these jobs. This is more like she said, stay home, sleep all day, be on the computer or the phone or whatever that they be on. We gotta start getting them up more, getting them up, putting them out there just like they have to go to school. But now they're working. And this is where entrepreneurship comes in. Everybody's not gonna be a basketball player, football player, singer, dancer, or all that other good stuff that comes to them naturally. We need to have places out here that are teaching these youths, about different trades and different things that they can do. Otherwise, they fall to the streets. It's a setup. It's a setup. We can't just say what we're gonna do and we don't do. But I just wanted everyone to know here that it is a process that the Lighthouse and Connecticut Works go through in regards to these youths getting hired. And some of them come to work, like I know where I'm at, and they don't make it. You have youth that don't want to be around kids. You got youth that don't want to work in warehouses and different stuff. So they have to match them. They orientate them, and the employer also needs to orientate. Give them more money so that they can hire more youths and get this job done for our children. That's what I feel.
Okay.
150,000, 250,000, give it to them. It's worth it. To keep our children off the streets and out of trouble. Give it to them.
You all set, Denise?
I'm all set. I'm all set. The guys and the kids. The youths.
Excuse me, through the chair.
That's
If I
right.
can just respond to Councilwoman Valla's question.
Oh, she's back.
She's back.
Yeah.
So, Councilwoman Valla, just to let you know, we have applied to SWACA for an additional, for 20 hours for the elderly Hispanic position. So we're waiting to see if SWACA will grant that to increase the hours for the elderly Hispanic.
So if the hours are increased, right, again, will this person that works 40 hours a week on her main job is going to be able to come and do the work that is mandated by that grant?
If she cannot do it, then we're gonna have to hire someone who will. And then to the question of Lighthouse, all the parent fees and revenue grants, that stays in Lighthouse. It does not go to the general funds.
Okay. Gotcha.
Hi. So my first question is that in regards to the inspections, how many do you have full-time?
I currently have 7 with 1 vacancy, but analysis and studies in the past have shown that I need a minimum of 10 for the amount of restaurants and enforcement that we need to do.
And what kind of budget would that look like for you to be able to hire 3 more?
I don't remember the step 1 on the register sanitarian. I can get that information for you. But it will help us because, again, we have so many illegal businesses that occur after hours, and so that overtime budget is there. But just to ensure those that are licensed, especially the 3s and 4s, need 3 and 4 inspections every year. And so right now, we are behind on some of that because we just hired someone new who's still on probation, but he's got experience, so he's hitting the ground running with Tyrone. But I still have to fill Sean Tipp's position if and when he comes back.
You okay?
For now.
Okay.
put it down.
Okay, Lorette?
Okay, I have a question about anti-blight, so if you could help me understand this. Blight, I think it's called, right? It's blight. Now, okay, so someone brought to my attention, this, on a residential street, there's this lot that had a bunch of abandoned cars. Now, I don't know if it's a business or if someone's just hoarding junk cars. So I don't know what that falls under, but either way, it's not good. And there's been many complaints, and then as we, Michelle and I drove past it, and we didn't see anyone working, like working on it actively, but obviously it shouldn't be there. So like, does that fall under a business operating illegally, or,
So to answer your question, first we would have to get the address, and then what our inspectors will do is they will identify who the owner is and what, if it is a business, right? If it is a business,
just rent it
commercial.
out. Someone owns it and they rent it out.
So we would send an inspector out, they would do the investigation, if they find out it's an illegal business of cars or they're just dumping cars, we would cite them, but we work with public facilities and Joe Esteban, if I'm not mistaken, and PD, to help get that stuff out and cleared. But we usually start, when in doubt, we can always categorize it as blight, so that we can investigate it. If it doesn't fall under our jurisdiction, we will send it to the appropriate department that has the enforcement capabilities for that.
Right, because I wasn't sure which way that.
Okay.
This is in reference to
Another question, sorry.
the zoning,
The zone.
what the question was asked.
If it fits in, the zone of the area, because it's.
Right, so if it's not zoned
No, it's not
for that, then we bring in zoning, we bring in
Okay,
buildings,
it's
we bring in the,
residential.
we work with a lot of the other divisions, because we don't have zoning jurisdiction. We just say, hey, this is a vacant lot or a private property that's being used commercial, we would refer it to the other.
Refer to, so I don't have to do that.
No, you would just make the complaint and you can email me or call me and I forward it over to Jen, who will assign it into the system for the inspector. If it's not ours, we will then refer it to the appropriate division, whether it's police, zoning, buildings, and fire.
Okay, thank you.
You're welcome, Ernie.
Yeah.
It's a good question.
Back to the summer programs. For youth getting jobs. I've had a lot of young people, I told them to call down to this Lighthouse program. Help me understand this. How many, in any given summer, let's say this summer, you said you got 500 applications for people that wanna work for something, is that correct?
Correct.
But you only have enough for 250,
Correct.
is that correct? So,
225.
225?
Or requesting, yeah. Last year they got 800 applications.
So you need another 250 in order to hire the 500 young people that want summer jobs, is that correct?
We're asking for an additional 150 so that we can get up to 225. Yes.
225, okay.
But through the chair, if I heard you correctly, if we want to hit the 500, yeah, we would need another 250 kids if we were to able to hire everyone that applied. But because we don't have the financial means to do it, we can only go with what the money allows us to do, which currently is about 130 to 150, but we're asking for 85 more. But we have
And those jobs are working in the parks, working with kids, those kind of things throughout the city.
Yes, yes.
So that's what their jobs are. So it's not like they're going to school to be trained to work for companies. This is just for the summer.
Correct. 20 hours a week, either the morning or the afternoon. They're placed in different divisions within the city. They have the Audubon, does the parks in the summer as well, so there's other partners that pay, and then they work through them for the 20 hours of the week.
Now, let me ask you this question, and it's my second question. The money, the revenues that you do bring in, right? The revenues that you do bring in, you can't use none of those funds?
No, so the
for your
parent
summer
fees,
program?
right, the parent fees stay in the school that is paid, so it goes into that program for that school. The summer youth does not get any revenue that we can use from any other division.
Okay. All right. Put me down again because I need to talk to him about something else.
Doc, I have a question and then a statement. So I hear Councilman Newton mention he had inquired about the different types of I guess organizations, the various organizations in which the children are, the youth are placed during the summertime. Specifically, are they, so I'm assuming summer youth programs, right? So they would work with smaller age children, right, in the summer youth programs. Any other, like, do they work with municipal departments?
Yes.
Okay, so for example, which municipal departments would you say they would work for?
For example, I'm Vital Records, but we did get one of the workers last summer to work in Vital Records, and he was excellent. He came in every day, and what he did is he reorganized our entire vault. Obviously, you know, we have all the birth, marriage, and death certificates in the vault that we lock up at night, and it's a fireproof. He reorganized everything alphabetically for us, which would have taken months for any of my staff to leave their current position and try and do this in between time.
Yes.
So this particular person that came from the program worked in Vital Records for the entire summer and did this entire project for us.
So they're working with summer youth programs, they're working with various municipal departments. They also, I'm assuming they're also working with other nonprofit organizations that are collaborating with your department. So I just want to make a statement. I feel like this is very vital and important that we support however way that we can fiscally. I was a youth summer employee. I started when I was 14 years old. This is when I was not raised in Bridgeport, I was raised in Stanford. And this was through the city of Stanford and the Urban League and another nonprofit that I can't recall offhand. And so my first official summer job was at the housing, housing authority. Thank you. It's no longer called housing authority, but yes, housing authority at the time. And it was me and another youth employee. Her name was also Nicole. We both of us as grown adults now reside here in Bridgeport, both of us. But at the time we were 14 years old and we were not great employees. We had to learn, right, through the leadership of the department head. And I won't get into it, I won't get all into it right now. That department head of the Stanford Housing Authority is now the only African-American state senator. Patricia Billy Miller, yes. It was a growing experience, and it taught both me and the other Nicole strong to improve on our work ethic. So I'm in great support of this. So however way we can support this program and go further. Thank you.
Okay. Anita.
All right, back to me. Okay, I just want to make a comment with regards to the Lighthouse program. I'm in full support. I mean, I'm in support of even increasing it to $250,000 if we possibly can. But I do have some issues. There's a pattern here in the city of Bridgeport that city staff or family of city staff are the ones that get hired first and then the community. I think we need to reverse that. I think we need to do the community and whatever's left over, then hire staff of the city of Bridgeport's children or family members, because then we'll give an opportunity to the children that are out in the community to come in, whereas every year, staff of the city of Bridgeport should not be dependent on their child or grandchild to have a job with the Lighthouse program. We open it up to the community first and then open it up to the city staff. That's all I want to say. Full favor, if they can find $250,000, I think that'll be much better than the $150,000. Now, let me move on to health and social service. Okay, I want to go to the grants while they're up. Who is the project manager overseeing all the grants?
So the project manager is the department supervisor.
Which is?
So if you see the Century 21 down to DCF, it would be Regina and Mark, that they handle the lighthouse. Per capita is myself with Tammy and Central Grants. Heart disease and stroke prevention, it's the contractor with myself, Central Grants, and Tammy. Ledge Light FEP, I have Jada Venison is my emergency preparedness coordinator, so she's in charge of the reporting, and then I have supervision over that grant. Same thing with the gun. So let's put it this way. At the end of the day, all the grants end with me. And so I meet with the department supervisor to say, where are we with the grant? What are we doing? What are the outcomes? What are the deliverables? And then Central Grants does the financial reporting, and we do the program reporting.
So, okay, so who can we get the statistic numbers on the services that are provided under these grants?
If you provide me what exactly you're looking for, we can try to get that information for you.
Okay. And can I just end with the records? Put me back.
Okay.
Okay, so I just have a small little touch on vital records. I think vital records is the less attention department that gets attention from the city, but the revenue driven with birth certificates, death certificates, marriage certificates, over the night mailing, and I think that the staff in this department does a phenomenal job, and after reviewing the budget, looking at the numbers of their salary, it's poor to say that they're being underpaid. And I have said this before during budget session, and the CAO's office has heard me, the mayor's office has heard me, that department needs a whole revitalization. It is disgusting. It is totally disgusting. Their IT needs to be updated. Their database is like, there's always an issue. Either the system is freezing, the credit card machines are freezing. I mean, they need a whole uplift in that department. But most importantly, the staff needs to be compensated accordingly, and not as staff that does not have a, I don't wanna say something that's offensive, but like a high-ranking degree, like they have a bachelor's or something, because they're doing a lot of work in that office, and I'm downtown every day and I see the stress that goes on in that office with people coming in, whether it's with a birth certificate that has the wrong name on it, whether it's, if Jessica or Michelle is not available, yes, they get stuck. I mean, it's very stressful. I just needed to say that. Just write me back for the next round, please. Thank you.
Maria.
Maria Prayer?
Which one?
Maria Prayer, sorry.
Okay. Can we go to slide, page 28, slide 56?
What page?
Page 28, slide 56.
Lighthouse?
Slide 56. I'm really shocked by the revenue numbers here. When I left the school board in 2019, Lighthouse was generating over $800,000 a year in parent fees. And I was always concerned that it was, a lot of it was cash at the time. I know when I sent my daughter to Roosevelt School, it's on a sliding scale of your income, and I was paying cash. And so I was always concerned about, but I am concerned because this was as of April 8th. So you really have April and May left because Lighthouse pretty much ends early in June. So it looks to me like the maximum revenue that you're gonna collect for 2026 is $532,000, when this used to be close to $900,000 a year. And I'm trying to understand why such a huge loss of revenue?
There's a few variables to that. One, since COVID, parents got used to not paying because they were given so much of a break. So it became a trend not to get used to that break for fee payments with the fees. Additionally, the funders have capped us in terms of how much we could charge the parents. So for example, the fee was $20, but the funders have now capped us at $15, which is why you may see a reduction as well. So for example, for the school year, it was $20, now it's $15. Where for the summer it was $40 we were able to charge, now it's $30. And in addition to that, we also can now, they also are now preventing us from requesting proof of income. So it's kind of suggested that we, it's more of a suggestion as far as the payment is concerned. So we can put on that, we ask them on the application what their income is, but we are not allowed to ask them for the proof. So they're kind of tying our hands and as it relates to how we're going to be able to collect the funds.
Okay, I'm not sure who they is, but.
The funders, the 21st century, the
Okay,
funders.
can we go to slide 55, which is right above this?
This one?
Yeah, so what I see here is there are 8 elementary middle schools in Bridgeport that do not have an on-site lighthouse program, and my concern is 6 of them are on the east side, the most impoverished community in the city. And I know the Edison kids have to jump on a little bus and get over to JFK, but it's not on site. And I'm sure that really de-escalates how many kids and families sign up for it. And then I see that on the handout we were just given, there's a specific request to add Rafaela Taylor Center. And I don't understand why we would add Rafaela Taylor Center when we have 8 elementary schools, actual elementary school sites that don't have it. And Dunbar, I guess their kids are going to, Tisdale, which is 3 blocks away. So, so this is concerning to me. I feel like there's some targeting here. I don't know why 6 of the 8 schools are on the east side that have no lighthouse program.
Right. So in terms of Dunbar and the Rose and being at the Taylor Center, when it was in operation, when we had the grant, the actual site operated from the Rafaela Taylor Center, which is why that was the ask. It was run from the YMCA was the actual provider for the site, and they ran the program from the Taylor Center. So that's why the request was to return it to that particular site. And as it relates to Edison Hall and Dunbar, it ran as one cohort. So when it was 2024, I believe, it was a cusp of us applying for the grant, because remember they would operate in a cohort, and it was also the time that Edison Hall and were anticipated to close. So we had to make a decision whether to apply for that particular grant or not, because we didn't want to apply for a grant for schools that were slated to close.
Well, if I could just respond, those schools would have closed for like 5 years, you know, so I mean, they're not, and of course, I'm gonna tell you right now, Edison and Hall will not be closing.
Right.
So I'm sorry, Edison and Beardsley will not be closing.
Yeah, at that time, it was slated to be closed, yeah.
Yeah, but it takes years.
Maria, we're not here to talk about school closing.
She raised it.
No, you said your school ain't gonna be closed. That's what the meeting's for.
She raised that the reason.
Let me say this.
I get to say what I want to say related to my
Well,
question.
I guarantee you this, you won't ask another question tonight, since you running your mouth.
Oh, okay.
All right. Let me say this. Number one.
She raised it.
I'm not talking, I'm talking to you.
I was speaking before you interrupted me. She raised it and I responded. She raised it.
I'm chairman.
Okay. You're chairman. You're not a dictator. I don't live in North Korea or China.
I guarantee you this. You won't speak no more than that.
Okay. Okay.
let me say
No,
this.
excuse you, I'm sorry.
Dunbar, since you brought it up, is under contract, we're changing contractors. We want to bring the Lighthouse program to run the Taylor Center and be a part of it. That's why Dunbar is on here, okay? So that's the East End, which he has nothing to do with, okay? So carry on, she's not to speak anymore tonight.
Oh my God, you're so ridiculous.
Okay, Reverend Lee?
Okay, thank you, I'll drink to that.
I'll play that.
You're ridiculous.
Well, you won't speak no more tonight.
And you're probably
Order.
the fact
I see you, Nita.
You wanna start with it?
Okay, praying hard tonight, y'all. Thank George for bringing up the revenue, and that was one of my questions, and also, the grants and the revenue. Now, I would like to say that, and I was hoping that Mark came back down. I'm having a senior moment, okay? If y'all forget. Okay, so the thing about it is that I think that, and then maybe we should discuss this in the budget meeting, because I'm not sure whether we can do it or not. All the money that's coming in for the altitude and Lighthouse, maybe we should go back to them. You know, then we just, have the money to do whatever.
It does go for programming.
But I saw
It's a lot
some,
of programming.
yeah, okay, so, but I saw some, I asked the question my first time and say, where do that money go?
And I apologize, Reverend, because I misunderstood. The Lighthouse, all their collected revenue stays within Lighthouse.
Oh, okay,
The rest of the health and social services goes to their funds, so I apologize.
Thank you.
To answer your question, I believe the state requires us, the money that comes in the revenue, we can't spend on nothing but into the Lighthouse, back into the Lighthouse.
Okay.
That's the only way we can collect the fees.
Okay, you know, I worked under you and in the Lighthouse program, and when we used to see him coming, we used to hide, cause he didn't smile like he was now. But one thing about it, he kept things in order. People did what they were supposed to do, you know. So what I want to say now is that let's talk about the Friday Night Live, and we also gonna talk about those schools too, the kids too, that he could. Every kid do not want to work. My thing is, and I don't know how we can do the application. If you don't go to school, you ain't gonna go to no nothing else. You know what I mean? And the reason I say that is that I'm not gonna call it a name. I have a girl that's been in my class for about 4 months. She been in school for about 1 month. That don't make good sense to me. And then about the parents. Let me tell you something. The parents can't make those kids do nothing. If you cannot come to school, then you can.
Yeah, I do.
Who is that?
It's Ivy.
She unmuted herself probably.
Oh, there you go.
Mute yourself, Ivy. But what I want to say is that, you know, those applications, if a child want to work, I believe that he should have a chance to work. That's how I got through college, these summer programs, A, B, C, D, aerosol, whatever the case might be. And if it wasn't for those programs, I wouldn't have been able to get the degrees that I have. So, you know, I'm for one believe that I don't know how we can go, you know, I can't promise anything because I'm not for one vote, you know. But when it comes down to the Lighthouse, I think that you all are doing a great job of what you have. And the last thing I want to say is, and it's not a question either, is that I think it was 23, 24, in my program, Taking Back Our Village, I went around and asked business owners, you know, could you hire this person for me? Could you know, hire? I didn't pick no particular person, But when I finished, I had about 30 jobs for 30 kids, you know what I mean? And then, you know, sometimes we talk about what should be, but we don't give no, yeah, you know what I'm trying to say, I'm here to see you all. You know, we don't give no, advice, to the kids, yeah, right, to the kids. You know, we can talk all night about what should or should not be. But what can we do to help? And it's not all in this book right here either, you know what I mean? There's a lot of people,
Because we got other people to get to.
well, then they gonna have to wait on me. Well, I waited on them. I waited on them. I just drank my Pepsi and waited on them.
I know you are drinking that, that's good.
So now, so what I'm saying is that we have to make sure that we help solve the problem. And I hope we do that in the budget meeting, okay? I don't have enough, and I'm not gonna be as long as some folks I know. Come on.
Thank you, Mary Lee, appreciate it very much.
Thank you. So I can ask 2 questions, right?
2 questions, please, Mary Lee.
Thank you. Okay, so what is the plan moving forward? As it appears to me and folks in the community, that we do not have a structured help to help our seniors with the rebate program. So what is your plan in moving this rebate program forward? Because I know that there was a meeting, that I was not very happy at that meeting, things that occurred, and questions could have been asked, should have been answered, it did not take place. So, right now, I know that the renters rebate program is in shambles because we have some of the people, some of the residents are being directed to the Eisenhower Center, and then some of them, if they cannot get to or what have you, they have been coming to the Eastside Center to get help in filling out that application. So I would like to have an answer, and even again, our council people, they do have seniors in their districts that need to know where, as I know Success Village has been sending text messages about the renters rebate program.
So, for the moment, in all transparency, our Director of Clinical Services was put on administrative leave, okay? And so I have identified gaps within that. So a quick solution for us so that the seniors can still be served. I spoke with Marie Heller, and they are being rerouted to the Eisenhower for the moment. The plan is, and always has been, that whoever comes in under the renters rebate will be going to the senior housing, meet with the residents that live in Augusta, Twin Towers, any of those, right? To get the applications and be done on site. Because of the vacancy in the moment, we're a little stagnant. As soon as that position is filled, and as soon as we get an interim director of social services, that individual will also be going out to the community. I've spoken with Marie Heller as well to be able to do some outreach to the senior housing areas to go to them if they can't come to us. So I am putting a plan in place for that because I have spoken to Mr. O'Sullivan to make sure that it's correct, and as long as we can provide the services to the seniors where they are, we are doing that for the moment. So because the individual was placed last Thursday, we had to pivot very quickly, and a way to do that was to send them to Eisenhower, to Black Rock, to whoever can help them in that moment. So for the moment, that is the short-term plan. We plan to fill it. We plan to go out to the senior housing areas to meet them where they are, and we are meeting with the program, the house managers coordinators for the senior housing to gather the applications and bring them to us so we can enter them into the portal.
Okay, the other question is this: how many staffers are working with an MOU for additional pay. So again, evidently there's vacant positions in the department and individuals are being used or they're doing this work for additional pay. How many of those individuals are in your department and how is your reorganization going to alleviate the need for this particular MOU?
So there is no one in social services that has an MOU for additional duties. Off the top of my head, I can't, I have one individual that is assisting me because I do not have an administrative assistant. So there is one person with a MOU to help me run the back end of the office works. But off the top of my head, that is the only thing that I can think about. I only have one person with an additional duties agreement for the moment.
All set? Okay, Anita.
All right, here I go again. All right, I'm going to Veterans Affairs. I think that, how many staff members are there outside of?
It's just Cindy, and she has a vacancy right now, which we're going to post for her clerical assistant.
That was my question, because I think she is overworked.
Oh, yeah.
Her workload is extremely, tremendously high.
Yes.
Now, I guess I missed, I had a question, let's see here. Okay, so with the Department of Aging, I have very serious concerns with, I missed the portion of the rent rebate. I did catch the end of you're gonna be sending staff to your senior centers or something?
Yeah, so, right, I don't know if you heard it, so the current director of clinical services has been put on administrative leave. And so she was doing the renters rebate program. Because she was put on administrative leave, I had to pivot, and so I spoke to Marie Heller, who has always helped us do it. So her and Lisette are we are redirecting the seniors there, but they can go to the east side, they can go to Black Rock. They are still the senior housing complexes. Let's call them their house managers, because I can't remember, coordinators, are taking the applications and they're gonna be bringing them to us. Nadine had already scheduled some on-site visits, but I have to wait and see if she's coming back or not. And then if she's not, we're going to then have to either do an additional duties to help somebody with that, or we can hire someone right away so they can go on site to help collect all those applications for renters rebate.
Okay, the reason I wanted to bring that up, because I think that from being downtown and speaking to some of the seniors that have been coming in, some that are my constituents, there's a level of disorganized transparency in that office, inconsideration, inconsistency, and lack of Hispanic communication.
Correct. And we do have
that's a problem, because some of the seniors that are coming here, some are coming on the bus, some are being dropped off by family members to only be told that they have to come back. That's not the proper way of doing it.
So to answer your question, if I may, we do have Proprio, which is the translation service lines, that is available. One of the problems that's happening over in Social Services Division is the IT. The cell phones don't work. The IT is really bad. It's in that area, but IT is working to get extenders, because if you even try to call on the phone, there's no reception, unfortunately, in that back end. So if you have different parts back there, so we're working with IT to try to improve that. But you're right, and I have heard complaints that the Spanish-speaking Spanish-speaking constituents are not being spoken to in the appropriate language. I had addressed that because that is the purpose of having Proprio there, amongst the other issues, right? So one way that was an immediate pivot is Lisette Echevarria does speak Spanish, so she's able to help those that are there. And anyone that comes in, I've already instructed April and the staff, if they have everything completed in the application with no paperwork missing, they can leave it there and we will process the paperwork. I have access to the portal, so if I need to input everything, I will do it myself because I did it last year. So we will try to accommodate it as much as we can. Because this happened so fast on Thursday, I did not have an opportunity to make an announcement to say, hey, come over here, come over there, because we are accepting people without appointments. This time it's anyone can just walk in, so I can't control who walks in. If at least they who had an appointment, I can call you and say, hey, Mrs. Martinez, you know, we have to move, but people are coming in without an appointment. And so we'll try to get them there while they can, but if they're speaking Spanish, they have to go to Eisenhower for the moment.
Well, let me say this. When the rent rebate program reopened, I believe it was the 1st of April?
Yes.
Okay. Since it reopened, they've been coming in without appointments.
Yes, they've always come in.
So this has nothing to do with who's on administrative leave or not. The issue is that they're coming in, they're waiting in the front, or they're waiting in the back. And they're waiting for an extensive amount of time. 3 of your staff who are non-Spanish speaking. And if they're looking for a Spanish speaking person, you're not available, Maria's not available, Jennifer's not available, who can help these people? They're told that they have to come back. That's unfair. That's why I mean, there's no structure in that department, there's no consideration. It's like, we're talking about 65 and over, today, there was an 87-year-old that was there that got turned away. And that was around 11:45 this morning.
Because the only one
No
who
one was
doing
able
it-
to help her
Correct.
this morning.
The only one who was doing it and was trained to do it was Nadine. April can't take it, Laquisha, Shakia, it's not part of their job. They're in different unions and that's not their role, right? So we have to change that. And I can't have an age doing a LIUNA position because the renter's rebate is a LIUNA position.
Well,
So if we can interview, ideally, we would need someone who speaks Spanish to be able to help that.
So what I want to say to that, Dr. Rodriguez, is perhaps maybe we should think about organizing it, close down the walk-ins for right now, organize it properly so these poor seniors are not coming there and having to wait outside for a ride to pick them up, or they get discouraged. I mean, the little lady today was crying. Literally, you can see it on the camera. She was crying because nobody was able to help her. On another note, I would like to, and I'll come back, because we're in environmental health, and we talked about that, I would like to applaud, and we're not supposed to say any names, but I will, Maria Guida for a job well done, for helping, bring in the revenue that she has been bringing in, at looking at the numbers. I mean, she came in and she restructured and did a whole turnaround, so I'm gonna give kudos where kudos is due, so. List me again, please, thank you.
Fredo.
Yeah.
You're up. There you go.
Dr. Rodriguez, I just wanted to, I know, I brought 2 people to the other, they came here,
Right.
but when they got there, I guess it's new paperwork that they didn't understand was they have to get notarized.
Yes, that's a barrier. We need to change some stuff.
Because a lot of them, like, viejitas, they don't, they gotta look for somebody to notarize, and if you don't, but I did, I try to assist them as much as I can, but that's a barrier too, because it's, and the lady parked way down, and she had to walk, but yeah, I would appreciate that, because I guess I was involved in that, notarized. From the landlord.
Yeah, the landlord read form.
Yes.
Okay. Nicole?
So I'm hearing that there's a translation system, what is it called,
Proprio.
Proprio. Please explain to me because I'm not privy to it.
So Proprio is a interpreter translation service line. So in my previous job, we used it. So it is a phone app. So all of my inspectors, so all the health department staff has it on their city cell phone app, or they dial a phone number. Whatever language the resident speaks, Spanish, Chinese, Haitian Creole, Portuguese, whatever it is, you select it, and they've been instructed to get the interpreter's ID number, put that in the documentation, and they will be spoken to for the language that they understand. And if it's Puerto Rican Spanish, Mexican Spanish, Colombian Spanish, they will get an agent in that. Yes, because each Spanish language is different. It is also available when we are translating any and all of our health department information. into the appropriate language, and it would be in the 3rd and 4th grade reading level, so no more Google Translate, because it's not inappropriate. So, we put that in, and it's working tremendously when it's being used.
And the second, you already answered, I wanted to know, because I know that the demographics show that we do have a large population of Spanish speakers, but we also do have, Haitian Creole, we have.
So I've selected the top 5 languages in the city, so it's Spanish, Portuguese, Haitian Creole, and I think it was like Chinese. Mandarin, yes, Mandarin.
My next door neighbors, they
Yes,
all speak
so,
Mandarin.
Again, it's just the top 4, you can select that, but it's every language that's out there. So if someone speaks Cantonese, Hindi, there will be an interpreter available for them.
Thank you.
All set, Nicole?
Yes.
Okay, Michelle Lyons, then Maria Bayer.
Okay, the question I have is, I'm sitting here, and I see a very much sense of all your needs, okay? Now, with all these needs, we have, everybody comes in with all their needs from each department. I guess the biggest question is, and you probably maybe will come around to figuring out, because we're not gonna be able to supply all your needs. So I probably guess, since, you're the head of the department there, is to figure out, and I know it's hard, I wouldn't want to be in your shoes, okay, that's good, is to figure out what is the most important person in which department that is gonna be the need for 2026. And I hate to place you on that spot, but you're the head person, and because you're the head person, you have all these responsibilities, but you do a good job of it, okay? And I think that that's gonna help the budget committee. And I know it's a hard question, and it's a hard statement, and it's a hard solution. I mean, I am in favor of helping the youth out, yes, but that's a whole different ballgame. We're talking about personnel. So you're gonna have to say, okay, like, who could really, listen, in every department, in every session, you have people that are more than stronger and capable due to their experience and due to their time serving. We have some people right over here, okay? And on the audience here as well. So I would ask that. I know it's like a big thing, but I think that will help. So this way, when the budget committee makes their decision, they know the needs that the most. Otherwise, they may be putting someone in there and say, well, I wish they came that person, or I wish they came that. So that's just a suggestion.
Thank you.
Dr. Rodriguez, let me just, for the record, as the director, you have the right to move your staff. That's not the city manager's job. I appreciate you telling us we want to make these changes.
Okay.
But that's not our role, to tell you how to run your department. It's your job.
Thank you.
So I just want to set that straight. Yes, you laid it out for us, but that's none of our business. That's your job. That's why you hired as a director. That's your job to do that. That's not our job. To tell you, I think you need to put somebody here. You come to us and say, Ernie, we can make more money. If I had more manpower to do certain things, that's what our job is. All right, so I want to make that perfectly clear. I appreciate you sharing your Bible with us. But it's not our job to tell you how to run your staff. That's why you make the big bucks. Oh, I'm sorry. I didn't use no numbers.
Maria Bayer.
So you mentioned a gadget that you use to translate, right?
Propio.
Propio. I don't know how Propio really works, because yesterday we had a senior that walked into the Eastside Senior Center to do his application. And he was very hurt because I guess Propio, when he spoke Spanish or he spoke to somebody, the person there said, you need to learn English. That's that. But, so I'm just saying.
With an interpreter line?
No, somebody there in person told the old man, you need to learn English. okay? And then you wonder why Maria Valle loses it sometimes. But anyway, the other question right now or concern is the Red Cross. When there is a fire, there's a big disconnect between the city of Bridgeport and the Red Cross. And so what can you do, or what will you do to fix that? Because again, there is a big miscommunication.
Can you give me an example of where the miscommunication is coming from?
Look at Pembroke Street. Okay, now, as some of us know, we're getting sued because of that fire on Pembroke Street. Then you go to the one on East Main just recently that Mr. Medina called me and said, Maria, there's a fire over here. So I knew there was a fire, but it's just that I couldn't get there at the time. But I did go and meet him there. And there was some confusion, and you could see a little girl, 6, 7 years old, right? You just have to look at their face. And then another mom in a car. And I know Mr. Medina made some phone calls, he was working on it, and then I know I called you, but I expected somebody from the city of Bridgeport Health Department who's in charge of meeting with these families, even if the Red Cross was there. There were some people that did not even register for whatever reason. Well, when there's a fire, people run to, somewhere. So there is a miscommunication between your department, the people that are working under that jurisdiction to assist the families whenever certain things happen.
So if I can answer that. So the way the process works is during a fire, the fire department requests the presence of the American Red Cross. They come first on scene, and then Mike Griffith will email me, social services, and let us know the names of all the affected individuals who sought or are seeking assistance. If it happens over the weekend, the protocol is Monday morning, our code enforcement relocation officer or coordinator will touch base with Mike and say, where are they housed, where are they hoteled, and then they make contact with the residents. And then what is offered, referrals are made, we won't mention names, but the coordinator reaches out to the affected victims or the individuals and begins to say, do you need housing? Reaching out to the landlord, are they coming back? An example of that would be the East Main Street fire. Some of the individuals are placed in the hotel under the Uniform Relocation Act, which is an unfunded state mandate that requires us for $4,000 we have to pay up front, which we don't have, and that is one of the reasons why I requested money into the relocation fund, because we can't provide services when we don't have money in the budget. This is an unfunded state mandate that says for every individual, not so much family, every individual gets up to $4,000, and on top of that, they get a first month's and security money to pay for housing. We don't have that. We are robbing Peter to pay Paul. I am trying to find money in the budget. I have reached out to Ken Flato, and they are gonna help us with it. So, we are trying to help them. The other issue sometimes is when the residents are contacted, they don't want the help, or they don't want to seek assistance from themselves. And so that poses a challenge as well. But the way the protocol works is Mike Griffith will collect everyone's name. He tells us the name, the family, the children affected, what they received, if it was hotel fee, go to the hotel, or money, or the credit card that they get a gift card for it. And then we follow up on Monday morning, right? So we don't want to duplicate the efforts. One of the things that we have identified, and I'll say it as a nurse, during a fire and a trauma, people are not receptive with having so many people there on site. So you have the Red Cross, you have the fire, now you're gonna have a health department come in, all asking you the same question, and you're duplicating the efforts, right? So personally, the Red Cross has the expertise that's there to do for the fire and the response team. Mike does inform of what's happening. We take it. We are in communication with Mike, we are in communication with the residents, and we try to follow up as much as possible. When the residents do find out housing, They come back and we try to assist them with relocation money. Again, first month's for security. If not, we house them in the hotel. And we do tell them it goes up to $4,000 when we have nothing else for you. So how do you want us to help you? We either do $4,000 for the hotel, or we have to take some of that money for the first months in the security. Because I don't have it in the budget. If I had money in the budget for all these fires, because we have fires every single day, we would be in a better position. I can hire more staff. The reality is this, not to be defensive, but we have one code enforcement coordinator. I cannot have her out there every single night on a fire response. I can't, you're gonna burn her out, right? We've had people there. Jada now is going back and is the point person, my emergency preparedness person, but she's getting the same information that Mike is giving to her, and she's the point person. She then hands that information over to, I have to use names because I keep forgetting the titles, to LaQuisha, who's my coordinator person, and then LaQuisha then takes it from there and begins to contact the individual. I just have one person in relocation. If you're asking me what my priority are, I need more code reinforcement people. I need a relocation person because of the number of fires we have here. I need at a minimum 3 more environmental health inspectors to be able to get the food restaurants to where they are. I sacrificed my administrative assistant because we needed a nurse in that clinic as a priority. I really need 2 more nurses with the amount of patients that we have in this clinic to be able to revenue, right? But I'm asking for a lot. And I know I may or may not get it, but you ask me what my priorities are? I need a nurse, I need 3 environmental health inspectors, I need a minimum of 1 more relocation officer, and I need increased funding for relocation. Because if I don't have the money, I can't help people. And people I cannot force anyone to do overtime. And I can't force my relocation person, who's the one and only person, to do the relocation. I get called at night. I don't necessarily go out there because I can't do anything until the Red Cross does their piece.
No, so in what your needs are they here in this book?
I requested them through OPM and they were not placed in the budget.
So you see what I'm saying? So the other thing is this, I expect that if I am hired to be an inspector, I want to make sure that when you look at my resume, I have the credentials.
Correct.
Not somebody walking off the street or recommended my brother, my sister, my uncle to do a job and then they don't do it. Because then they sit and do not do the work that they need to do. So you guys heard that, you're the budget people, right? They should put that in. So that's something that we need to look at. Because I know, well, I don't even have to say it. Because we all know the need that is happening or that is needed in each of our communities. Whether you live in Black Rock, in the north end, whatever, there is a need.
Yeah, you're turning in.
Okay, I was looking for Mike, but he left. I think that the weights and measures department sucks. And I'm gonna be honest, and I apologize for being frank, but should be a very high-driven department. The revenue is extremely low. You cannot have 1 full-time person and 1 part-time person trying to bring in revenue to this city with the many bodegas and gas stations that the city of Bridgeport has. That is a serious problem that we need to fix. And I'm gonna say that I had a meeting with the mayor yesterday, and I told the mayor I don't have confidence in the city of Bridgeport no more, and neither do I have in him. Because this city is going backwards. And the leadership of this city needs to wake up, because at some point we are going to be in a serious deficit, if not in a bankrupt, because the revenue of how we use what comes in is not being used in the proper standards. And when we have departments such as weights and measures and the revenue is so low, how can 1 full-time person and 1 part-time person do all the work in the city of Bridgeport? You need at least 4 full-time individuals to bring in almost $1 million or so more dollars. Let me use the building department. In a 6-month period, he is almost at $2 million of revenue and permits. So how can this not be happening for weights and measures? We gotta get it together in this city. This is totally disgusting. That's on weights and measures. Let me go to our public health nursing. I would like to know, why does our public health nursing supervisor, Jody, has to be overseen by anyone when she should be able to operate her own clinical service department? And why has the city not replaced the building that was damaged, and we are lacking the services by sending people over to other places to benefit the revenue that the city of Bridgeport should be benefiting?
So as I said, we don't have a clinic right now, and we are working to try to get to another location. I know that the city attorney's office is dealing with the landlord of the Middle Street building to try to recoup some of our losses. Jody and I have talked about how we can improve revenue. We are upset. The STD patients are being sent to a clinic and charged $200, and so they don't go. And so they're not being seen, which means it's reinfecting other people, right? We see the barrier, but until we can have a place to stay, my hands are tied.
I wanna answer.
Okay.
I wanna answer regarding weights and measures. I wanna answer, and I wanna answer as to why a registered nurse with the skills cannot operate her own division without being supervised. She should be able to operate her own division outside of the health department. She has a registered nurse degree.
So through the chair, that's not my lane, I can't answer that.
I know, I want you to answer the
I
fact
can
of the
answer
building.
about the clinic.
Yes.
So we've been going through, we had to have an adjuster come in. So first we were trying to figure out if we could go back into Middle Street. It would be the cleanest, quickest thing that we could do. We have had a series of other issues there, we've had no heat. This is not the first leak we've had in there, so we have now said goodbye to Middle Street. We are working on a lease for another place, which actually has more parking, because Middle Street, that was one of the issues there. We are working with the new landlord to build out the clinic, and that to be absorbed in the cost. So all of this has just taken time, but believe me, I know you are upset, no one is more upset than that woman over there. When it comes to this, she wants to get into her clinic, we want her to be there as well. So I know today there was a meeting about the Madison Avenue lease. Oh, I'm sorry, I thought you were talking to me. There was a meeting today in Tom's office about the Madison Avenue lease. So we are trying to move in as soon as we can.
All right, thank you, Constance, for answering that.
And if I can answer your question for weights and measures, I did request a position.
Yeah. We are aware of it. Readily.
I don't wait. When something bothers me, it bothers me. I don't have a question, but when we on this, every question to me is a good question. Every wrong answer is a wrong answer. A good wrong answer. I feel like, I personally feel like, but I could be wrong now, there's favoritism in this body. Some folks can say anything they want to, as long as they want to, and some can't. That's all I have to say about that. And I'm not gonna get in no argument, don't look at me funny, because I said once and I say it again, favoritism is not good. I'm finished now, ready to go home, eat my dinner.
We hope we didn't make you feel that way, Reverend. We apologize if we made you feel that way, Reverend.
Yeah, you did really make me feel that way.
Then I apologize, Reverend.
I accept your apology.
George, please.
Thank you, Mr. Chair. No, in all fairness, I work in the building that Dr. Rodriguez and her staff had the office on Middle Street, and my colleague, Tasha Spell, also works there across the hall, and that building has been terrible. With constant flooding, your sister, also Councilman Newton, experienced the same thing in her office. She had to move out of there. So it's unfortunate what happened after they spent all that money, the health department, to fix that place. It was beautiful. I went in there a few times, just to be nosy, just to walk around, and I worked right upstairs, but they lost a lot, and the landlord is a hard-headed knucklehead. They deserve to be compensated for everything, all the equipment, everything, and also for the displacement, the money that they have lost due to this, the clients, the patients. This landlord should reimburse it, but I just want to put that out there. That is why that department in that particular area is receiving low funds. It's because of that, not because of them. It's because after they invested so much money into that building, to that part, the building structure was not good to them. So we have to, I asked my colleague, let's take that into some consideration. Thank you.
Okay. Anybody else there kind of leave? Oh, we're gonna let me know, then we're gonna close out. I said, when you're up, you give it 2 questions, then we'll close out. So you get 2, so you may get 2 good ones.
Take your best 2.
Okay, take your best 2 shots.
No one. All right, so this is not a question, this is a statement, so it doesn't count as a question. So I want to go to, let me just say kudos to our housing and commercial code enforcement for the revenue for a 1-year grace period, 141K. That's excellent. Now, I want to go to the lead department. I believe, from what I have witnessed and seen, that the lead department should be restructured because the lead department staff should not just be sitting around. They should be active in finding homes to visit and not waiting to be given assignments to fulfill the means and the needs out in the community. You have too many lead inspectors sitting around that should be out in the community fulfilling the needs and the needs. Okay. Now, this is the biggest compartment I was waiting to reach to. Social service. The social service department is failing because the lack of resources, the listing of distributions that should be available, that should be provided by the city of Bridgeport, and it should not be a task of the staff to find. The elderly service program from social service sucks. Homeless issues, there's actually no plan, no follow-up, no placement or supportive services. We touched on the relocation funding. I have to agree with you. The money that should be allocated for relocation so that the relocation coordinator can fulfill the means of relocating, whether it's fire, whether it's homeless, whatever it is, should exceed at least $2 million. The amount that is given under CDBG, $50,000 for relocation, is totally a disgrace. Mm-hmm. No one can fulfill any responsibility with that bit of money. Without the help, and I have to say, and no disrespect to nobody, but this department is the most micromanaged department that the city has, and I have seen, along with others, that there is no set structure to fulfill the needs and the means of this department. With the relocation, the fair rent, the renter's rebate, I mean, it is all. And we really need to get it together. Whether it's when whoever is replaced, if they come back, if they don't come back, I don't care about none of that. Get somebody in there that's going to meet the goals and put a plan in place that's going to fulfill the department according to the standards so that everybody can be helped and everybody can be rehoused, be relocated, if the social service department is not gonna have the money that's needed, then why is the social service department open? Why? Close it. If we cannot meet the needs of the people, then close the department. And I'm gonna end with this. I'm going to thank, and I'm gonna name names because this was a process that was implemented by myself, Maria Gueda, David Reyes, and we included Dr. Rodriguez in to restart the Joint Committee Task Force as it was set when Bill Finch was in office. So I want to thank Maria for her efforts in doing what she did, because it looks like we're getting somewhere here in the city with closing some of these illegal establishments and these unlicensed establishments. And I'll end with that. Thank you.
All right.
All right, I want to first apologize to all you. Sometimes individuals' lives. I'm glad the gentleman worked it out and everything is good. And Dr. Rodriguez, we're going to definitely look at your department, the budget committee, and figure out a way where we can help you raise more revenue to the city, because your department can bring in a lot more money if you had some more people. And that's what we did with upstairs when they put the code enforcement. They brought in a lot of money. So we're definitely going to look at this department to make sure we put some people in there that can bring revenue in, because that's what we need. We don't need to just give people jobs. We need to bring some money in here to help us. So we will co-chair myself and council president when she gets back, and whoever else in the mayor can be a part of this. And, you know, put the money where the money should be. So if all minds are clear, can I get a motion to adjourn?
Motion.
Second.
All those in favor?
Aye.
Any opposed?
No.
Thank you.
Let's fight everyone.